Aleeftvng, be inspired.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Brothers and sisters, today we'll be talking about typhoid enteritis, of typhoid fever. Now, when you talk to individuals, most often they would come to you, doctor, I have typhoid. I begin to wonder, how can this individual have typhoid and he's on his 2 feet and he's been running away, going about his daily activities? Well, we need to know that typhoid fever is a very serious disease. It's caused by an organism called Salmonella typhi, and this can be contacted through the eating of contaminated food, contaminated drink, or the fact that flies that are carrying these organisms come to your food and you eventually still do go on to take it. How does a patient present when they have typhoid fever? Usually, there's a fever that we say is stepladder because it's climbing and coming down. The patient also has headache, has joint pains, has lost his appetite, has some pain in the abdomen, and some other symptoms. These patients usually are not the ones that will be walking around because, as I said, typhoid fever is a very serious infection. And we need to say this because a lot of the laboratories that we have around, once you say you have fever, the first thing they do is, oh, let's test you for typhoid. And they come up always with a positive diagnosis. It's not always true. Typhoid fever can affect anybody, anyone of any age who has come in contact with the organism. Again, typhoid fever, like I said earlier, you can get it from drink, you can get it from food, and it can come from contaminated flies. Now, how do you know that you have typhoid fever? I've said you must be properly diagnosed, but you do not just go to a roadside lab because you'll always come back with a positive diagnosis anyway, whether you have typhoid fever or you do not. Food in terms of milk, ice cream, contaminated juices, anything, vegetable salad can all be taken. Once they are contaminated, the individual will have the disease. The incubation period is from 10 days upwards, 10 to 14 days. So you could not have gone to a party yesterday, taken some vegetable salad or some water, and then say, oh, it's because you were infected yesterday and so today you have typhoid. No. Typhoid fever, like I said, is very serious. And the complications actually are what we should be wary of. Because if it's indeed typhoid, the individual, if not properly treated, can end up with complications which include perforation of the intestines. And of course, you know that kind of individual cannot be walking around. You could also have an individual who has not been properly treated. He would say, oh, I've left the hospital, I've taken this, I've taken that. But he's still giving off the infectious disease. We call these ones carriers. And if such carriers are food handlers, that the entire community are in danger because they'll keep exiting the organism and everyone who takes from that food can be infected. How do we prevent it? Improved sanitation, both personal and environmental. Ensure that you don't take milk unless it's pasteurized or it's been boiled. Ensure that your source of water is good. Otherwise, make sure you boil your water. Ensure that the feces in your environment is properly disposed of. You're not living in a place where everybody is doing his thing along the streets. These are the easy ways in which you can avoid typhoid, and ensure that your hands are all washed, because sometimes when you visit somebody who actually does have typhoid infection, you could get contaminated by shaking soiled hands, and then if you do not wash your hands and you eat with it, then you will also take the contamination away. Well, today this is the much that we can take on typhoid enteritis. Inshallah, we'll provide another opportunity for us to discuss further. Assalamu alaikum.
Aleeftvng, be inspired.